Assalamu alaikum. Good evening, everyone. Welcome to our webinar. My name is Ala Al-Umari, and I'm a clinical pharmacist and specialist in patient safety at Saudi Patient Safety Center. And I will be serving you today as a moderator for this session. You will be hearing a presentation from Dr. Sara Al-Qahtani, who will be speaking to us on medication safety in high alert situations. Dr. Sara Al-Qahtani is a clinical pharmacist with 8 years experience. She got her master's degree from King Saud University in clinical pharmacy and currently works as a clinical pharmacy and medication safety manager in Dr. Sulaiman Faqih Hospital. Directing the pharmacy quality improvement activity to ensure compliance with patient care and medical practice standard and protocols. She got first-hand experience with the policy development functions of the health services system and worked with the quality improvement and patient safety department to establish medication safety culture. She is a project manager and super user in pharmacy automation, including smart pump infusion and clinical-based data decisions. She also has several publications, articles on different clinical topics. And I would like to remind you, our dear participant, that you can submit your question at any time during the session, which will be answered at the end of this session. You can use the Q&A icons at the bottom of your screen to share your question. And now moving along to our session, please welcome Dr. Sara Al-Qahtani.
Good evening. Welcome to this webinar, and thank you for attending today. My name is Sara Al-Qahtani. I am clinical pharmacy and medication safety manager. Today, I will present the medication safety in high alert situation. This is our objective today. We will define the high alert situation. We will present the initiative, regulation policy, and experience done in Saudi Arabia to overcome a medication safety event related to high alert situation. We will outline the key step in developing an improvement strategy. We will identify the appropriate resource skills needed, and we will share the challenge and lessons learned. The high alert situation in medication safety, as a part of the Global Patient Safety Challenge, the World Health Organization started initiative called Medication Without Harm, with the aim of reducing severe avoidable medication harm by 50% over the next 5 years. This initiative, as the WHO asked the country and key stakeholders to prioritize 3 areas for strong commitment, early action, and effective management to protect the patient from harm, while maximize the benefit of medication safety. This, namely, the errors are not preventable, but are often provoked by weak healthcare system. And so the challenge is to reduce their frequency and impact by tackling of some of weakness in the system. They are focusing on 3 areas. The first one, the medication safety and transition of care. The second one, the medication safety in polypharmacy. And the third one, the medication safety in high risk situation. So the high risk situation in the context of medication safety related to those circumstances which are associated with significant risk of medication related harm. The high alert situation are important and more often associated with a significant harm due to unsafe medication practice or medication error. Why this important? Because the environment of the hospital is risky, and there are they identify 3 main factors that contributing to the high risk situation. The first one, high alert medication. The second one, healthcare provider or patient factor. And the third one, system factor. As you know, one or more of these factors acting alone or in combination may trigger unsafe medication practice or medication error. So we should be careful attention to these 3 factors and take strategies to prevent the error associated with these factors. طيب, now I will ask you a question. What classify a drug as high alert medication? Is it ability to look and sound like another drug, or it is difficult spelling, or it's expensive cost, or it is narrow therapeutics index? Please answer this poll. The healthcare system environment is complex. It's combined of human factor, technology factor. All of these required a sustainable strategy to prove an efficacy and develop, implement in conjunction to reduce the risk of harm associated with the risk situation.
دكتورة ما في صوت.
Sorry, I will repeat. Okay, the high alert situation and medication safety. As you know, the healthcare intervention are intended to benefit the patient, but they can also cause harm. Why they may cause harm? Because the system by itself is complex. It's include the human factor, the technology factor, that bring a significant benefit to the system, but also it's involve a risk for patients. That's why we need to have a sustainable strategies of a proven efficacy can develop and implement in conjunction to reduce the risk of harm associated with high risk situation. Previously, we mentioned three factors that may contributing to the medication error. The first one, the medication error, and we mean that the use of high alert medication, which is low therapeutics index medication, and we mean that the low ratio of maximum tolerated dose of medication to the minimum curative or effective dose. The second factor, the provider and patient factor, and this includes the poor prescribing practice by healthcare professional, which include the overprescribing, underprescribing, and misprescribing. However, the error may occur at any stage of the medication process, including preparing of medication, dispensing, and administration. The third factor, the system factor, like we mean the work environment, including the setting like the hospital or the high risk situation, for example, in the OR, in the ED, in the neonatal care. All of these are stress factors that may lead to the error. We will start with the first one, the medication factor. The high alert medication, that drug have a high risk of causing significant patient harm when they are used in error. Although the mistake may or may not more common with this medication, the consequence of error are more devastating to the patient. So we need to develop a list of high alert medication. The ISMB have a worldwide list of high alert medication, but also we need to develop the local high alert medication list that regularly updated so they can help the healthcare professional to focus on a particular risk in their own workplace. Such list will be useless if we don't use strategies to prevent the high alert medication. For example, we can use a high auxiliary label that states this medication is high alert medication. We need to do an independent double check during the preparing or dispensing or administration to the patient. We need to double check the indication of the medication. Also, we need to make sure if this electrolyte medication, it should be diluted before administered to the patient. The second term we need to be familiar with, it's adverse drug reaction, which is related to 6.5 of hospital admission medication error and may not result in harm. And although every medication has the risk during use, the medication-related harm can be reduced with appropriate prescribing, responsible use, and implement strategies that minimize the risk. For type of adverse drug reaction, it's traditionally classified under two categories. The first one, type A, which is normally those of the non-pharmacological effect of the medication. The reactions are common, it's often predictable and generally associated with the medication which have a low therapeutics index. This means that even when we increase the dose in a small concentration, it may result in harm to the patient. So even dose of the medication within the recommended range may produce adverse drug reaction in some individual due to difference in response to medication, and as safe the dose range may be narrow. The second type, type P, the effect is often unpredictable and sometimes allergic and natural and not related to the known pharmacologic of the medication, and it's less common than type A reaction and have higher mortality rate. For example of type B reaction, it's maybe include skin rash, sometimes severe, which can occur with a certain antibiotic, and other immunological reaction. Some of the serious adverse drug reaction associated with type B reaction, it's severe, it's cause anaphylaxis and might cause malignant hyperthermia. So this is the list of medication, high alert medication. It's easily recorded using the word pinch, which A stands for anti-infective, P for potassium and other electrolyte, I for insulin, N for narcotic and other sedative, C for chemotherapeutic agent, H for heparin and other anticoagulant, and maybe it's due to other medication than this listed here. This is a question, please answer it. The majority of you answering the paracetamol, which is the correct answer. It's not including to the pinch list. So the pinch, the P for potassium, insulin, we mentioned it, and chemotherapy. Okay. The first strategy to reduce the harm from high alert medication, we should standardize and systemize of a process and documentation, including naming, packaging, and labeling, are important in reducing the harm from high alert medication. For example, one study found that when we standardize the sliding scale protocol for insulin, they found it's associated with a better outcome in hospital inpatient. As you know, weakness or deficiency in protocol, guidelines, or training of staff, or safety culture, all of them can cause or may lead to the medication error. The second strategy is assessing the safety risk of products. Product can be assessed using a risk score approach, such as medication error potential assessment, which reflect a product's suitability for use based upon a wide range of factors, such as the clarity of label, the packaging, the availability of patient information, and the other found that some evidence found the barcoding of medication, it might reduce medication error during the preparation and administration of medication. The third strategies, reporting and learning system and pharmacovigilance center. As you know, the strong safety culture is one where errors are anticipated and watched for, where the risk is proactive, assessed and managed, and the healthcare professional feel comfortable and confident to discuss and report error and near miss and learn from them, which mean adaptive just culture in your organization. The second strategy is use of multiply strategies. As you know, the healthcare system is a complex, and the ISMP recommend that single strategy for addressing the risk associated with high alert medication in acute care setting is insufficient. So we need to choose strategies that influence many steps of medication management system as possible. As I mentioned, we should use multiple strategies. That strategies implemented successfully previously and proven the effective and recommended by experts. We should select strategies that are sustainable, and several risk reduction strategies may be used together. Moving to the second factor, the healthcare provider and patient factors. As you know, even the most detected healthcare professional, they can make error. The act of prescribing, dispensing, and administration medicine is complex by natural. So normally involve several healthcare professionals with the patient necessary being as part of. So in a broad term, this picture show you the prescribing process, include prescribing in deciding whether any particular medication or combination of medication is indicated. The doctor should assess is the patient need this medication or not. He should make sure the right dose, the right frequency, the right time. Also, this should be happen during the preparation and dispensing and administration of medication. The error must commonly occur during the order step of the medication, but it can occur at any time, including the storage, prescription, preparation, dispensing, and monitoring. Also, the resource limiting is characterized by the lack of electronic support system for prescribing or dispensing, overcrowded for patient staff, shortage and inadequate monitoring. The poor prescribing has been described to take in three forms. The first one, the overprescribing, which is occur when a medication is prescribed whose risk of harm exceed its benefit. In particular individual, every prescription required the exercise of good prescribing skill to assess the individual risk versus benefit. We should, as I mentioned, to assess each medication, the risk and benefit to the patient. The second one, under-prescribing, which is occurred when medication is not prescribed, whose likely benefit exceed the risk of harm. The acquisition of sound of therapeutic knowledge and skill by the prescriber is the key to minimize this risk of underprescribing. The misprescribing occur when either the wrong medication is prescribed or the wrong dose, route, frequency, or duration of administration is selected, and it may occur as part of medication error. For the patient factor, one study of more than 1,400 adult inpatients, they found 26 of them experience at least one clinical significant medication error. They found the age and number of prescribed medication are the two major predictor of the risk of experience medication error. As you know, the adverse drug event usually happened in the extreme of life, either in the young children or in the other older people, and especially in the older people because they are receiving many medication, what's called polypharmacy, which lead to the adverse drug events. Another study showed that the error more likely in female than male. The patient factor, the first one, polypharmacy, the number of prescribed medication was the major factor for predicting risk of experience medication error. The second one, the multi-morbidity, it's become more prevalent as life expectancy increase in many countries. The meta-analysis includes 75 studies from primary care demonstrate that mental physical multi-morbidity was associated with increased risk of active patient safety incidents and prescribing error. The third factor, high-risk medical condition. Certain medical condition predispose the patient to increase the risk of adverse drug reaction, especially if the patient have renal or hepatic impairment or cardiac failure. So the strategies to reduce the second factor related to provider and patient factor. First one is education. It's important for safe medication practice. We should educate any newly staff or even in the student intern how to educate them about the medication safety importance. The second one, the medication reconciliation. The prescribing error occurred at transition of care. Pharmacy-led medication reconciliation and hospital admission may also have economic benefit. And here in Saudi Arabia now, the majority of hospital mandate the medication reconciliation when the patient transfer from level to the level. Okay. This is a question, it's a true or false. Medication reconciliation is safety practice. A safety practice designed to minimize the patient for adverse events related to medication discrepancy. It's true or false. Okay, great. A majority of you answered it's true. It's the medication reconciliation is safety best practice with the aim of minimizing potential for adverse event related to medication discrepancy. The strategies to reduce the medication error related to patient factor. The 5 moments for medication safety. It's focus on 5 moments in medication use process where action by the patient, family member, or caregiver can greatly reduce the risk of harm associated with the use of medication. It's mainly the patient is engaged or it's patient engagement tool developed to support implementation of the third WHO Global Patient Safety Challenge, the medication without harm. The 5 moments are starting medication, taking my medication, adding medication, reviewing my medication, and stopping my medication. Each moments enter have 5 critical questions, some self-reflective for the patient and some require the support from healthcare professional to answer and reflect correctly. The third factor, system factor, work environment. The environment in hospital can contribute to error provoke a condition. The clinical ward may be busy or understaffed. It's contributing to maybe it's lack of supervision or failure to remember to check important information, or interruption during the critical process, such as during the administration of medication. All of these factors may lead to significant patient harm or medication error. So a strategy, workflow interruption, noise, busy work environment can be distracting when prescribing, dispensing, or administration. Tapered have been warned to reduce the interruption during prescribing or administration of medication, but the evidence for this value is mixed. Also, as I mentioned before, the strategies successfully implemented or proven efficacy should be used. The strategies should be sustainable. The selected strategies should be sustainable. The second part in this presentation, the initiative, regulation, policy, and experience of Saudi Arabia. As you know, during the COVID, there was a lot of shortage of medication and vaccination. So to overcome all of this obstacle, the Ministry of Health, the Saudi Arabia, decide to nationalize the pharmaceutical, medical device supplier and vaccination industry, and it's part of the vision of 2030. They also empower and promote a national industry and local content in terms of diagnosis, vaccination, and treatment. They establish a national committee for prepare and response to the health emergency, epidemic health disaster, under the leadership of Ministry of Health. They defined the committee, the role and responsibility to allow for rapid and effective response to a different situation. They develop healthcare security and self-sufficiency strategies to guide all the phase of planning, managing, securing, and nationalize the need of the kingdom in terms of medication, medical supplier, and equipment. Also, the availability during the Hajj season, they make sure the availability of mandatory vaccine in preparation for the Hajj season, along with the availability of emergency medication. They update the Hajj plan yearly to handle the new global hazard and pandemic, to have a smooth and safe Hajj season. Also, during the COVID-19, the MOH provide national guideline to standardize the management of COVID-19 and kept updated to the most recent evidence base. Also, the Saudi Patient Safety Center developed a confidential national report platform for healthcare professionals to share the potential or action medication error that occur within a hospital, a primary healthcare, or community pharmacy, with the aiming to collect, analyzing, and present the recommendation from reporting medications on safety events. It was launched on 1st of September. They now focus on MOH hospital, but in the near future, they will include all the hospital, primary healthcare, primary healthcare, and community pharmacy across all the kingdom. Why strategies planning for medication safety important to every hospital? The strategic planning process allows the organization to strike a much needed balance between the managed short-term needed of the patient and also to planning in the long-term goal of the organization to ensure the patient safety. The safe medication use required careful planning and cannot achieve if all of the organization is only focused on the short term of the patient need. The error involved the use of medication. It's the largest single cause of medical error in the hospital. طيب, the model strategies plan for medication safety, it's have a 7 long-term goal. The first one, to create, communicate and demonstrate leadership-driven culture of safety. Second, to improve error detection, reporting and use of information to improve patient safety. To evaluate where technology can help reduce the risk of medication error. To reduce the risk of error with high alert medication prescribed and administered to a high-risk patient population. To establish the blame-free environment for response to error, which is called a just culture, and each organization should adopt the just culture. To involve the community in medication safety initiative, and medication self-management program. And the last goal, to establish control formulary in which the selected medication are based more on safety than the costs. This is question, true or false question. Hospitals should establish a blame-free environment for responding to error. Is it correct or false?
دكتورة صوت.
ايوه بس على بال ما يجاوبون. The majority of you answering true, which is the hospital should establish a blame-free environment, so healthcare provider will be more comfortable in reporting the medication error. طيب, now I will focus on detail for a key step in developing important strategies. The first one, the appropriate prescribing and risk assessment. The medication safety should start with appropriate prescribing and through risk-benefit analysis of each medicine. As I mentioned, the doctor should evaluate each medication that the patient will take. The second one, medication review, it's multidisciplinary activities where the risk and benefit of each medication are considered with the patient and decision made about the future therapy. It's to optimize the use of medication for each patient. The third one, dispensing, preparation, and administration. The right of medication of administration include the 7 rights: the right patient, right to drug, right time, right route, right dose, right documentation, and right response. The fourth one, communication and patient engagement. Proper communication between healthcare provider and patient and amongst a healthcare provider is important to prevent the error. Okay, the fifth one, medication reconciliation at care of transition. It's a formal process in which a healthcare professional partner with the patient to ensure accurate and complete medication information transfer at interface of care. طيب, the resource and skill needed, organization learning, teamwork within unit, feedback and communication about error are among the strongest aspect of patient culture. Positive patient safety culture includes supportive organization attitude, to learning continuous improvement, good teamwork within a unit, and support from the hospital management for patient safety. The coordination medication management across care transition assists with the care coordination for transition. طيب, major factor contributing to medication safety problem and challenge, it's including the unrestricted public access to medication from various hospital and community pharmacy. There are a communication gap between the health care institution and patients. Also, we have a limited use of important technologies such as computerized provider order entry, the lack of a medication safety program in hospital, under-reporting of medication error and adverse drug reaction, a multi-language and different background healthcare professional, and the last one, high workload. All of these are challenges that hinder the medication safety. For the suggestion to improve the medication safety practice in Saudi Arabia, we need to continue education for all healthcare providers. We need to do a competency assessment for any newly joined employee and especially focus on medication safety. We need to development of a culture that encourages medication error and adverse drug reaction reporting. We need to use technology proven to decrease the medication error, and promotion and implementation of national patient safety initiative. دكتورة علا.
Thank you, Dr. Sarah, for the presentation. And for our participant, SPSC is glad to remind you that the registration for the third SPSC Patient Safety Conference is open now, and you can find the registration link at our Twitter account and webpage. Okay, we'll move now to the Q&A question. So, Dr. Sarah, we have two questions. The first one, why reconciliation is important? Medication reconciliation is important.
The medication reconciliation, it's important because it's reduce the morbidity and mortality of medication error that occur when the patient is transferred from one unit, for example, from medical to the another level like ICU. The doctor may forget to reconcile the medication, or forget, يعني omission, it's mean omission. And it's cost-effective use of health care, which is important element for patient safety.
Thank you, Doctora. And we have another question is, can you give us an example of a key strategy for medication safety?
Actually, we have a lot of strategies, but from my experience, one of them is failure mode effective analysis and self-assessments. It's basically proactive identify risk and how they can minimize it in our hospital. The second one, it's maybe standardized, as I mentioned in my presentation. Another one is simple, like reduce the number of steps in the process of handoff or handover without eliminating the crucial elements. We can use technology, we can maximize the access to information like this.
Okay, thank you, Dr. Sarah. And on behalf of the Saudi Patient Safety Center, we'd like to thank Dr. Sarah Al-Qahtani and the audience for their active participation. And as a part of the Saudi Patient Safety Center effort to provide you with timely topics and interesting speakers, we would appreciate if you would fill out the evaluation survey provided at the end of the session. Thank you for joining us today, and we look forward to welcome you back in future webinar. Thank you.
Thank you so much, Dr. Ala. Thank you for attending and looking to see you again.